Now let's talk about vancomycin versus teicoplanin. So I'm not into the brands and all, but if you're working in the hospital, you may have heard of Targocid. In most of the hospitals, patients are getting admitted, and we'll immediately start with, in most of the hospitals, it has been seen that they start with maybe a meropenem, and then they will add a teicoplanin to it. The content of Targocid is teicoplanin. So basically, teicoplanin, it is also of the same class as that of vancomycin. Teicoplanin is also of the same class. So vancomycin belongs to the class of glycopeptide antibiotics, and teicoplanin also belongs to glycopeptide antibiotics. But there is small difference between vancomycin and teicoplanin. The first major difference is vancomycin causes very significant nephrotoxicity. That is why the trough levels of vancomycin need to be monitored, especially if it is being used for a long term in the patient. But when it comes to teicoplanin, nephrotoxicity definitely is a matter of concern, but not to that extent of vancomycin. That means the risk of nephrotoxicity is actually less in teicoplanin in comparison to vancomycin. Vancomycin is very good for CNS infections. In fact, when patients are admitted with, symptoms of meningitis and you're not exactly sure as in what is the organism in the brain, empirically, vancomycin is given, but teicoplanin is not given because teicoplanin has very poor penetration in the CSF. So that is why usually vancomycin is preferred. So this is some of the differences between vancomycin and teicoplanin.